Welcome back. Facebook taking steps to stop the spread of anti-vaccine misinformation across the social media platform. The decision coming after a Senate hearing where 18-year-old Ethan Lindenberger testified about how he defied his mother and got himself vaccinated. He joined me yesterday. Here's what he said earlier this week when he joined me.
In my testimony, I explicitly said that change is taking place and that more strides could be taken to make sure that misinformation doesn't spread. And I think that with Facebook and YouTube, they're not necessarily to blame. It's just that the platforms have been kind of used to spread this misinformation more effectively. And that's just concerning, at least.
That was on Wednesday of this week. Joining us right now is board-certified medical doctor, Dr. Jeanette Neshawat. Great to see you, Dr. Jeanette. Thanks for being here.
It's my pleasure.
Your reaction to all of this about vaccinations, what can you tell us?
First of all, vaccines save lives, and I am so excited, and I thank and I commend Facebook and Mark Zuckerberg for taking action, because this affects everyone. This affects our children. It affects adults. I mean, just look at the recent measles outbreak, the biggest outbreak that we've had in decades with measles, and that's no joke. Measles can cause brain inflammation and pneumonia and ear infections and hearing loss and death. So it's about time that they are taking action. And I hope and pray that other social media platforms will follow suit and do the same thing.
I know that Pinterest has done something similar, that Facebook might be a little late to the party, and they're probably embarrassed, as they very often kind of act after they're embarrassed, after Ethan went in front of Congress and said my mother was reading this anti-vax propaganda and misinformation on Facebook in these Facebook groups. But again, what's the role in government in all this? I want to point to a story that was in the New York Times that there was one student infected with measles who went to a school, and at least 21 other people came down with the measles because of it. This is despite repeated warnings from public officials, health officials, that do not allow a student in school if they have not been vaccinated against the measles.
And I agree, because you're putting other people, other children, other teachers at risk. So I think the government should have mandates where if you're going to go to a public school or even a private school, you need to be vaccinated against meningitis, hepatitis, measles that can spread to the rest of the community and, could cause some serious harm. But it begins with education. Parents need to be educated. Doctors, healthcare providers need to educate, the parents, the children. And it's important to understand vaccines. Some people think, oh, this is all a big moneymaker hoax. It's not. Vaccines are free. You can go to the health department and get them for free. And the myth, it's a big myth that vaccines are linked to other diseases. That's not true.
So it's all a myth, you say.
Absolutely.
Yeah.
People can have side effects. That's a possibility. But vaccines overall, study after study shows they save lives. We once eradicated, for example, polio, and then just most recently we saw AML, a polio-like illness, paralyzing children. So when we have the ability, the advanced medicine and technology to save lives, as a doctor, I've got to advocate for that for my patients.
And get our reality back. I just got back from Malawi, Africa, and I can tell you right now that's a country of 15 million people who wish they had vaccines and the mamas to give their babies. So it's just, we got to get our reality back and realize again where we are. I think we get comfort in our comfort zone here in America and feel like everything is bad for you, and there's always a big, government ploy
you're
to put things
right.
in.
This is an evidence of, we were all supposed to become smarter and better educated because of all the information on the internet.
Yeah.
And this has made people dangerously dumb.
Too much.
Where they gravitate to what they want to hear, whether it's in politics or information about their health. I can't tell you how many conversations that I've had with people. Somebody on Twitter with a blue check mark next to their name telling me that there's a nerve pain drug, gabapentin, that my mother's on, how it's misprescribed, and it's not used to treat pain. Well, yeah, it's used to treat nerve pain in cancer patients, you dum-dum. But why do you have a blue check mark next to your name and you're spreading these lies? Yeah. Sorry, it's the same thing with vaccines.
Amen.
Well, I'm glad they're blocking and banning anti-vax information, even though they're late at the game.
What about the price of health care? A new article from the Journal this morning titled this: Trump administration weighs publicizing secret rates hospitals and doctors negotiate with insurers. This report says it would expose the actual cost of care for the first time. Look, if you start putting out there the amount of premium that these hospitals and others put on drugs, it's going to be bad for them.
Drugs, correct. Drugs and procedures. You know, why are drug prices so high? Why is there such a variable in the cost of an appendectomy at one hospital versus another? I'm a little iffy about this. I'm concerned about unintended consequences. But at the same time, could it potentially lower copays and deductibles and maybe create more competition in the market?
Shine a light on it. Shine a light on it.
So that's a possibility of exposing these exuberant drug prices and procedural costs that might benefit patients. But I think that we need to focus more on transparency, listing up front the prices of drugs, the prices of procedures. It's really not so much a secret. Patients don't find out their costs until after the fact, until they get their bill in the mail and they see cost of $300. Insurance covers this much. You're responsible for this much. So they need that transparency to make the decisions, to have more options to decide where they want to go and get their health care.
All right, great insights from you, Dr. Jeanette Neshawat. Thank you so much.
It's my pleasure.
We'll see you soon.